We're here this morning at Thomas Hospital, joined by Dr. Christopher Keel, and today we're talking about a robotic procedure, the first of its kind in Mobile and Baldwin Counties, and you performed it, Doctor. Thank you so much for joining us.
Thank you. Yeah, we've performed several robotic procedures here at Thomas Hospital, which has been kind of the first of the kind here on the Gulf Coast. One of them being a robotic cystectomy. So we did a complete removal of the bladder for bladder cancer and did an intracorporeal diversion, which is where we take the robot and actually use it to divert the urine to the outside of the body to a bag. So we did all of that with just the robot through small incisions, all less than 8 millimeters in size.
Well, let's talk about the advancements in this and also the benefits of having this technology.
Yeah, so robotic surgery, it's been around for about 10 years, 15 years now. We've really changed how patients are treated for some of these advanced procedures, and decreased blood loss, decreased length of stay in the hospital, decreased pain, and better cosmesis.
Let's talk about who this is focused on, the type of patients that are okay with this type of procedure.
So the benefit for those patients is that they have shorter hospital length of stay and a better cosmetic outcome for non-cancerous operations. So there's a broad range of procedures that can be performed with the robot.
We're now joined by Paula Robey, one of Dr. Keel's patients. You know, you and I were talking about your experience with this surgery and also that you actually got to go home quick.
Well, with the robotics, Dr. Keel had explained to me that there would be less of an incision. There would be small portal sites that they use. There wouldn't be a large incision down the abdomen, and that would allow me to go home the next day, and which I did, and I was very pleased.
Because you were talking that you didn't want to have this surgery from the beginning. You were trying to avoid surgery.
We did everything over a 2-year period conservatively that we could, and each time it worked for a little while and then it failed. And so after several tries with stents and other things that we did, this surgery was the only thing left. And I was very fortunate that Dr. Keel came, and